When we look at why healthcare is going up in America, the next one, you can see that the lack of lawsuit reform may play a role. By these numbers, if you look at the years 2000 to 2002, a dispassionate view would show that doctors in the United States became substantially worse over a 2-year period. And we know that's probably not the case. We did not have a rapidly declining quality of medical professionals in those 2 years. But nevertheless, malpractice premiums went up considerably. So did it become more easy to sue or recover or threaten a suit than having folks being able to, or having all of us then having to pay the cost of that litigation? Remembering, of course, the United States is the most litigious society on planet Earth right now. When we look at the overall uninsured, when you see the 47.5 million people, if you back out non-citizens, it's a question that we have to deal with. Should we provide taxpayer health care to people who are illegally present in the United States? Should we? So then, I'm going to go quickly through this one. Remembering that we already have about 12 million eligible for public programs, about 9.1 million who are only temporarily uninsured, and about 7.3 million who have over $84,000 in income. Remembering the average income in the United States is 56. That would mean that the number of lower income American citizens who have lacked health insurance for longer than 12 months is 7.8 million. The difficulty is that number is not big enough to justify some of the proposals that are being considered in Washington today. So why are healthcare costs exploding? Well, we do have a disconnect between patients and providers, and that then causes some inflation. We've got payment for quantity. We've got obviously problems with fraud, waste, and abuse, especially that's always present in a government program, and medical liabilities laws leading to some of the most litigious societies on earth. By the way, the state of Illinois, a poster child for that, being home to not just one, but 2 out-of-control jurisdictions, Madison County, Illinois, and Cook County. So where could we build a consensus behind a reform bill? And in my view, a comprehensive reform bill would, number one, guarantee the doctor-patient relationship against government interference. Number two, that we would lower the cost of insurance. And then address other key problems, like you could read the list there, but I just want to focus on one, which is a substantial bipartisan commitment, I think, by this Congress, despite all you hear, to address the problem of pre-existing conditions and making sure that you don't have to face that. The last one, probably, the last point I have there, very topical, reducing the dependence on federal borrowing. Many of you saw that the federal deficit is now $1 trillion higher than estimated just a few months ago. And it concerns me greatly. At this point, the United States is borrowing at a rate of $160 billion a week, a fairly sustainable effort. When you look at the current system, the current regulation of healthcare, it's already quite complicated. And the question is, what can we do to simplify this, to lower cost? If we go to the next one, I would say that my answer is, what do we do? And what we need is the right answer, not the quick answer. Which is why I was particularly encouraged when the House of Representatives did not vote on this legislation in an all-night session with the bill just hot off the Xerox machine, that everyone has had a time now to be able to read the roughly 1,000 pages, which is right there. That's H.R. 3200 that we've gone through. So what I have done, when I got home from active duty in Afghanistan in January, I talked to my staff and other colleagues, and I said, you know, the number one issue of this Congress will be health care. And so we put together, through the Tuesday group that I co-chair, 34 GOP moderates to build what we felt could be a bipartisan health care reform bill. In brief, what does it do? Number one, it contains the Medical Rights Act that Congress shall make no law interfering with the decisions made by you and your doctor. And we want to put that into law. Number two, we want reforms to reduce costs, and that's principally lawsuit reform to make sure that we can reduce medical malpractice. Fully electronic medical records owned by the patient, so you can seamlessly go to your specialist without needing to repeat unneeded diagnostic procedures. And of course, aggressive efforts to fight waste, fraud, and abuse present in any government program. Third, reforms to lower insurance by broadening risk pools. And in my judgment, we should break up the little insurance monopolies that exist in the United States. Americans should have a right to buy from any state in the union. Because if you find a plan that is cheaper and more flexible, this is especially for small businesses, you should be allowed to do so. Also, individuals should get the same tax deduction that employers get when they buy health insurance for themselves and their families. So this is our alternative. I hope it comes up in the debate that we will have potentially as early as next month. But also we have the Speaker's bill, and that's this one, H.R. 3200. Now, if you look at H.R. 3200 in detail, the next one, the Chamber of Commerce put together this chart, which shows one version of what it looks like between you and the maze of bureaucracy. Remember, already in Medicare, there are 62,000 separate price controls. Because as you have the government take over, it becomes increasingly complicated as to how you administer what is 1/6 of the U.S. economy. When you look at the next chart, here's my concern. Currently, according to the nonpartisan Congressional Budget Office, the bill before the Congress cost $1,042 billion. To help pay for that, it would reduce Medicare by about $160 billion, and I'm against cutting Medicare. It also raises about $587 billion in taxes, but that doesn't cover the whole charge, and so it would trigger an additional borrowing of roughly $295 billion to help fund this bill. But if you, that's the snapshot. If you look at the big picture, according to the Budget Committee, you can see that the costs are somewhat contained because of the tax increase up through 2014. But then costs rapidly explode beyond revenues, dramatically accelerating the deficit and borrowing of the United States. Bottom line, transferring this debt to our children and asking them to pay it later in higher taxes. If we go to the next one, you can see what's concerning me right now. As you can see, with the deficit now reaching $9 trillion and expanding, we have a rapidly, and here's where the president is exactly right. He says the situation that we face fiscally is unsustainable. And you can see he's exactly right. What it means, though, is we have to have fiscal conservatives in the Congress that will stop the spending. If you look at, sometimes H.R. 3200 is called the Tri-Committee Bill because it was written by 3 different committees. And you can see what it does to the entitlement spending of the United States. And it's a considerable gap between resources and additional spending. Remember, 46 cents of every dollar by the Congress is already borrowed. And most of that borrowed money comes from abroad. So we would be asking to accelerate that borrowing. Already we've seen in federal auctions us going beyond the $160 billion a week. Some federal auctions have totaled almost $270 billion borrowed in just 1 week.